All right, let's talk about my various kinds of positive autonomy. The first one I want to talk about is what I call self-determination, which is the capacity and the opportunity to make your own informed decisions. Right? So notice that's different from liberty. Liberty is nobody getting in the way of you once you make your decisions. This is the ability to actually have decisions to make, right? And the ability to make them. So it's actually, to fill this out, I think it's easiest for me to fill it out by saying a little bit about what the scaffolding involved here is, right? So if you're going to be able to be self-determining, if you're going to be able to have choices to make and be able to make them, then what are the social factors that can influence that? Well, for one thing, we know that the capacity for self-determination is often fluctuating and situational. So you may be able to deliberate clearly about your choices, pick one, and stick to it in a context that's familiar to you, but take that same person and stick them in a busy hospital room that feels very alien and scary with people whizzing by and nobody that you know, and your competence to do that may be severely compromised, right? So somebody who can make a self-determining choice, if they're given a quiet room and time to think, that same person may not be able to make a self-determining choice in the wrong kind of situation. Right? Self-determination clearly requires good quality access to information and practical reasoning skills. If you don't know what your choices are, and you don't understand what the consequences of those choices are, and you can't reason well about what it will mean to make them, then you can't be in control of your choices. Interestingly, self-determination requires not just the ability or the right to choose, but it requires decent choices. So there's a bioethicist named Anita Silvers who has this great paper on autonomy where she's contrasting, in my terms, these aren't quite her terms, she's contrasting liberty with self-determination. And she says, going to a restaurant with a huge menu with hundreds and hundreds of crappy, unappealing choices does not give you more autonomy than going to an excellent restaurant that only has 6 choices on the menu, but they're all wonderful, right? Having good things to choose between can give you more positive autonomy than simply not being as restricted, but having crappy choices. I don't know if I'm supposed to say crappy, but I just said it 4 times. So. Okay, so if you put all these things together, what we notice is that respecting autonomy already, if you're worried about respecting patient autonomy, respecting autonomy means a lot more than simply not getting in the way of the patient's choices, right? Standing back and not interfering. One thing it requires is recognizing and protecting and enabling self-determination, right? Both helping the patient to exercise her self-determination, and also, because self-determination is fluctuating and situational, often helping the patient to become self-determining in the first place. So if we're thinking about, if we're going to go back to healthcare for a moment, or medical care, what would that mean? Well, it means things like when you're determining whether a patient is competent to make a decision, instead of just making a binary yes-no decision, oh, they seem really freaked out and they're babbling and they're irrational, I guess they're not competent to make this decision, thinking about, well, is there something we can do to change the context for this patient to create self-determination where there isn't any right now, right? Can we wait a couple days, actually, before making this decision for the person to have had time to calm down? Can we wait until their loved one, who they feel safe around, can make it here from out of town? Can we simply move them to a quieter room? Whatever it may be, right? Protecting and enabling self-determination requires attending to the kind of scaffolding that is in place, can be put in place, that can bring self-determination about or protect it where it didn't exist before. Key to protecting and enabling self-determination is the knowledge component again, right? Making sure that information is offered and packaged in a usable, comprehensible way that's suited to that patient, right? Not just informing in the sense of handing over an informed consent form with a bunch of information on it and saying, well, I've given the information, but actually doing some work to figure out, is this a patient who does well with images? Is this a patient who does well with statistics? What kind of information and in what package and delivered how can we give this patient to enable this patient to become self-determining where he may not otherwise be? Right? So to give you just one very quick example of that, think about statistics. Right? There are many, many people, I suspect a lot of us are in this room because of the various things we've chosen to do with our lives. Many of us probably have this in common. There are many people who, when we're trying to make a decision about our medical care, we want numbers. Numbers make us feel safe, right? We want to know, what's the rate of this side effect? What did this study show? We want stats given to us because those stats feel objective and hang on to a bowl and like they can give us clear guideposts when we're reasoning. There are plenty of other people who are freaked out by numbers, right? Numbers and statistics and things that have words like percent in them feel intimidating and cold and off-putting and scary. And throwing stats from studies at those people is not actually a form of useful informing, right? It may well be that analogies and visuals and other things can convey basically the same information for purposes of choosing to them, but in a form that they can use. My point about this is that the way that information is delivered actually feeds directly into whether the person is in a position to be self-determining or not.